Welcome to the Future of Dermatology podcast. I'm Dr. Farah Kamangar. What you're about to hear is a standout session from this year's SF Derm Conference in Napa, where leading voices in our field gathered to explore what's next for dermatology.
These are truncated replays from our original recorded sessions. Join us in September of 2026 to get the full impact of the SF Derm experience.
I wanted to talk about how I got started on the journey of thinking about facial disfigurement, which is really not something that I got training in as a dermatologist. But we see a lot of people who have stigma and disfigurement, as you know, and it's really a big part of what we deal with. I was taught about hemangiomas as a pediatric resident, and that they were very benign and that you didn't really have to worry about them. And then as a dermatology resident, I had the opportunity to participate in something called the Hemangioma Clinic, which really was a clinic dealing with vascular anomalies, but we called everything a hemangioma back in the 1980s. And there was this concept that we didn't want to treat these things because radiation had been a standard treatment in the 1940s and 50s for treating hemangiomas. People realized that that was really turned out to be a bad thing to do, and that was used for literally there are cohorts of thousands of children treated with radiation for hemangiomas, and adults treated for vascular malformations, and it really didn't help very much, and it caused harm. And then as I went out into practice, I had some experiences that made me think more deeply about this topic. So the Hemangioma Clinic, any of you who have been to UCS have dermatology have seen this portrait. It stands in the hallway of our dermatology department. It's Frances Torrey. She wasn't the chairman of dermatology because dermatology wasn't a department at that time, but she was a division chief. She helped to found in 1949 the Hemangioma Clinic, and really her mission was to prevent radiation unnecessarily. And I was a resident as this clinic was sort of in its final phases in the early 1980s, and then it stopped. But I remember it vividly because what they would do is they would have you sit in a conference room and the patients would be paraded in front of you, which was really, I was kind of appalled by this at the time, but it was a very vivid memory. But then when I was recruited to the full-time faculty, we reincarnated this as our vascular anomalies clinic, our birthmark and vascular anomalies clinic. At the end of my training in dermatology, I went to Chicago to work with really the mother of pediatric dermatology, Nancy Esterly. And she was my mentor. She was the mentor to many pediatric dermatologists. She was the mentor to people in the audience, like Morgan Magid, among others. And she was a student of hemangiomas, and she was one of the first people to describe the use of corticosteroids, the gold standard at that time for treatment of hemangiomas, before propranolol was discovered as a treatment. So when I ended my training in dermatology in 1983, I knew some things about hemangiomas. I thought I did. I knew they were common, they were benign, they had a characteristic growth followed by involution. I knew radiation was a bad treatment. That had been drilled into me. And except for truly life or function-threatening hemangiomas, what was recommended by my mentors, and this was widely accepted, was a hands-off approach. And this was promulgated very strongly by Alvin Jacobs, who really was considered one of the founders of pediatric dermatology at the time, who was at Stanford. So the idea was, why would you ever treat anything that was going to go away on its own? And what we told parents was, this is really not a bad thing. It's not cancer. You know, it's going to eventually go involute on its own. So we're not going to treat it unless it's closing the eye or it's closing the airway. So it's basically this. I was taught this is kind of a good news thing. You're telling parents, don't worry, it's not cancer. This is not that bad. And this is sort of my mental framework of what hemangiomas do, which is go away, which they sometimes do, of course. But I began to question this dogma. When I finished my residency, I went out initially to Kaiser into practice, and I saw an infant with a cheek hemangioma. And this was a big central facial hemangioma. It was growing very quickly. And her mother described this as like, this thing is exploding like a volcano. That was the terminology she used. And I basically said, don't worry, it's benign, it's going to be okay. And in fact, this whole center of it ulcerated. It was right on the central cheek. And I just started to not feel very good about what I was doing in terms of helping this family. So what did I do next when I realized that it wasn't what I thought? I called Dr. Esterly and I said, can I use steroids even if it's not closing the eye? And she said, yeah, you sometimes have to do that. Excuse me. Then I decided, well, I'm going to go to PubMed. We didn't have PubMed, I'm sorry. I'm going to go to Index Medicus. I'm going to try and read more and see if there's anything out there. And I went to the literature and I found a very interesting article by Nakayama it was a Japanese dermatologist. And he showed pictures that didn't all look like these were just going away and leaving nothing behind, because in fact, we now know that hemangiomas often leave scarring, and it depends on where the scar is. The majority of hemangiomas that a pediatrician sees don't leave scars, but the majority of hemangiomas that a dermatologist sees have a very significant risk of scarring. And so you can see these before and afters and the anatomic distortion. And if they're big and they're on the face, that's not really a good thing. And as I got more into my academic career, I decided to do ethnographic research on this. I really wanted to hear parents' experiences. And it turned out that in looking at facial hemangiomas that were potentially disfiguring, we looked at them and we just interviewed parents and we said, what's really going on about medical care, issues related to parent and child interactions. And we found that they really had reactions that were very similar to permanent disfigurements that were seen in, for example, port wine birthmarks or other permanent deformities. Parents expressed disbelief, fear, mourning in the growth phase of the loss of a child that they had thought would look very normal. Reactions of strangers forced them to confront social stigmatization. Parental reactions, and this is important, are often connected to extrinsic variables. So, for example, if you have someone who has themselves bad scarring acne, and they have a child with a birthmark, they may react differently than someone who really didn't have to worry about scars when they were a child. And about half of the people in the study expressed dissatisfaction with the aspects of the medical care, and they felt that really they had been reassured, but people hadn't listened to them. So one of the things I learned from this experience was to really question dogma and don't believe everything you read or hear. And when things don't make sense to you, when there's a cognitive dissonance where you were taught something but it's not feeling right to you, you should use your own experience and think about it and talk to colleagues. And this is really, I would say, a secret power we have, not just of me, but of all of us. And I learned to collaborate with others, because then that led to us being able to really study this in a better way. And I would just say fast forward to a much more effective treatment we have now, beta blocker therapy. We know that more than half of the patients we treat, well over half, probably 70%, we're treating to prevent scarring. We're not treating for functional impairment, although we do treat for that. But we were treating because we're trying to prevent permanent scarring from hemangiomas. So now I want to introduce you to someone that I first met in the hemangioma clinic at UCSF. He was one of the patients who was paraded through that conference room. And then I re-met him when we started our birthmark and vascular anomalies clinic. And it's not a HIPAA violation because he knows that we'll tell this story. David Roche. He was a patient of ours at the hemangioma clinic. And he went on to be a monologist, to be a performance artist, and tell the story of his facial disfigurement from his extensive venous malformation. He's an incredible, incredible person. He's actually written a wonderful memoir called Standing at the Back Door of Happiness, which I highly recommend that you go onto Amazon or go to whatever source you get this. And that is a memoir of his journey through facial disfigurement and what he did about it. But he tells a story. I remember this vividly, of doing a monologue about facial disfigurement, and this young woman rushing up to him afterwards and saying, "Oh my God, nobody's really ever spoken to this experience that I have too, of how terrible it is. And he's looking at her, and to him, she looks completely normal. But she says, my nose, it's always been just horrible that I feel like my nose doesn't look normal. And he's thinking to himself, her nose looks normal to me. What is going on here? But he learned from that experience that everyone carries around within them their own sense of shame and sense of feeling that something is not right about themselves. At least certainly most of us do. I think it's a very common human experience. And that, going back to what we talked about, the parental reactions to their own children having birthmarks related to their own self-image, that we can all relate to these kinds of experiences that our patients have by looking to ourselves and to self-awareness and thinking about what we carry that might help us to have compassion for what our patients are going through. And I think that's a really important insight that I learned from him.
Thanks for joining us today on the Future of Dermatology podcast. If you enjoyed learning about the science behind skin, make sure to subscribe, and we'll see you next time. As a reminder, this podcast is for educational purposes only, not for medical advice. Always consult your healthcare provider.